Erectile dysfunction in men is the loss of the ability to have a controllable erection or a maintainable erection. And erectile dysfunction is often called ED. You may see that referred. And it often happens after patients perhaps have diabetes, perhaps have hypertension. But in a center like this, it's typically after difficult surgeries for prostate and bladder cancer. And in those difficult cases, if patients don't respond to the routine medications that we all hear about in the newspapers, so-called inflatable penile prostheses can be used to actually reconstruct erections. Prosthesis surgeries are designed to be relatively straightforward, but it is surgery. It's typically a surgery that takes about 45 minutes. And because we're introducing something into the body, and again we can see from the drawing that we've supplied, the major risk because of the foreign material is the risk of infection. The risk is low. It's only about 0.5%. But it's dependent that the surgery is done perfectly and a certain amount of intravenous antibiotics are given. Along with the penile prosthesis reconstruction, a lot of times men who are having these same difficult prostate or bladder surgeries may also suffer from loss of urine control or loss of their urinary sphincter muscles. So these patients also can be saved. We can restore their urine control again with the use of another prosthetic device called the artificial urinary sphincter. And I think we can see a picture of that device here. So what we're seeing in this image is a device that essentially places another muscle in the urine system. It's not a muscle as we think, but it's essentially a hydraulic tourniquet that's scientifically designed just to perfectly close down the urethra when we don't want urine coming out. So the difference between our own muscles is that when we go to the bathroom, we just need to think relax, and our own muscles open. So in this case, there's a little hydraulic pump hidden in the scrotal sac. So when I push that, I open this new artificial muscle. I go ahead and urinate. But then it's designed when I'm finished to automatically close, so I can get dressed just like I normally would. I don't have to do anything special. I just need to get the process started by squeezing it, urinate, finish, get dressed, the device closes back off. I've got my new muscle working for me again. Over the last 35 years, I've actually done thousands of both of these procedures, both implanting the inflatable penile prosthesis and implanting the artificial sphincter. So in our hands, it's actually a fairly common surgery. It needs to be done in a specific center like the USC Urologic Institute. But in the proper center, these devices are going to have excellent results. One thing that's very scary for patients, especially if they've already had bladder or prostate cancer, is they've already had surgery to take care of a problem, and now the surgery has left them with either erection problems or urinary control problems. And we understand that it's scary for patients, but the nice thing here at USC is that we've developed the techniques using these prosthetic devices to correct essentially everyone. So the nice thing is that the options are here. We've had practically the world's highest experience with these devices, so someone can come here, feel safe. In fact, we're the referral center for these devices, especially if someone has had a surgery like this elsewhere, is having problems. We're usually the referral center where things are sent to get corrected.